We've done DIY dentistry stories before. This is something of a, if I can pursue a metaphor, a hardy perennial. It doesn't go away as a problem. What is the scale of that problem right now, though, do you think?
So I think it's massively increased, and particularly during the pandemic, because there was such a backlog of patients that weren't being seen. So, for example, we were shut down for about 3 months, the first 3 months of the pandemic after national lockdown. And because of that, people were resorting to pulling out their own teeth. However, the problem continued because when dentists actually opened up, what had happened is that people that were having regular checkups were no longer coming in for their regular checkups. And so diseases that were once reversible, such as decay, became irreversible and turned into things like root canals or extractions, which then led to people pulling out their own teeth. And because dentists are not seeing these patients already after the backlog, these diseases are getting worse. In fact, actually, there has been studies to show that about 2,000 dentists have also left the profession since the pandemic and in the last year. So it really shows that this is not just a problem of backlog, but also there just simply isn't enough dentists able to treat the diseases that are required.
Rhona, just that interesting point you make about people, it sounds the way you described it, almost falling out of the habit. So hitherto people who were, organised, they'd got the date in the diary, must see dentist again 6 months from now. But because of the way that lockdown in particular during COVID broke so many habits, regular habits, and that regular habit, and that's what it is, checking in with your dentist, faded from view, they got out of the habit.
Yeah, they got out of the habit of going in, but I think ultimately as well, there's definitely an element of desperation. I don't know if you've ever had toothache, but it's one of the most excruciating pains, and people just could not cope anymore. And I think that this problem is going to stay around for a long time. You already read the statistics from the British Dental Association. And the problem really is as well is that so many dentists left the profession, as mentioned. There isn't enough staff as well. And a lot of practices are burdened with the NHS contracts at the moment that are putting an immense amount of pressure for them to reach targets. Furthermore, the smaller practices that don't have the resources are really struggling in comparison to the more corporate practices as well. So really, it's become kind of this issue that's encompassing lots of different things.
Rhona, why the dentistry labour shortage? I mean, is it the case that people who did practice, did NHS work, have gone into, you mentioned that some of the private practices, which are presumably better paid? Is there a sort of cohort moving through, or all retiring around about the same time? Not training enough? I mean, I would have thought the money was there to attract people into it. Do we need to lower the level of qualifications required? Think radically.
So I think that's some interesting points that you raise. First of all, a lot of people were leaving the profession because of the stress. So as I had mentioned, because of COVID, when they were coming back to work, what was happening was the restrictions that were imposed on dentists were extremely stressful. We had to deal with something called fallow time, which was airing out the surgery between patients, which reduced the number of patients that you could see. We had to work in really heavy duty PPE, much more than we ever have done before, inability to breathe.
But that's all over now, Rhona. But Rhona, that's all over now.
Yes, no, absolutely. But a lot of dentists left the profession at that time. Yeah. So we had a lot leaving for that reason. Then you had a lot that were dealing with stress. So, for example, with the stress levels, they felt that they just couldn't cope with the amount of patients that needed to be seen. They had a lot of pressure with these contracts and so forth. And in answer to your question, there has been a problem with funding. Dental schools are actually not taking in enough students to train them. Now, this is a problem that has been recognised. You've got different faculties that are trying to kind of talk to the General Dental Council, to the government and so forth, and convince them we need to take on more dentists, we need more of the funding for the training, because simply the public needs it.